When can your pediatric psychologist breach confidentiality? Hi, I'm Dr. Julia. I'm a licensed pediatric psychologist based in a children's hospital. And here are some things that I keep in mind as a practitioner in Texas. So again, these will be things specific to Texas. And these rules are in addition to kind of general HIPAA protections. So everything we talk about will be kept private or confidential within the hospital system. That is a little bit different than in like private practice. So in the hospital system, my notes go into the medical record. I'm very thoughtful about the things I put into your medical record. An additional layer of protection is that our notes are marked as sensitive. So not everyone on the medical team can access sensitive notes. Other than that, everything we talk about will be kept private or confidential. And again, my patient is the child or the teenager. And so my goal is to maintain a rapport while also maintaining safety. And that's kind of where it gets a little bit messy. So something I always give a heads up about to the patient and to the families in general is if there's any concerns for safety for the child themselves or for somebody else, like they're threatening to kind of hurt someone else and there's plan and intent, all those things, those would be some things that I need to share with caregivers to ensure safety. If you're endorsing passive SI, different providers have different levels of comfort of when to share that with your caregivers. It also depends on like how supportive your caregiver is. A lot of us would err more on the conservative side of making sure that your caregivers are aware of at least like some mood concerns to ensure that you are safe and protected and are aware of your safety plan. The other exceptions would be if there's any concerns for harm, abuse, neglect, or trafficking of a person under the age of 18, a person over the age of 65, or a person with a disability. Those are things that we are, as mandated reporters, do have to report. Personally, I try to notify the caregivers and like just the family in general if I have to report something. Again, not always is there an investigation by a CPS or anything like that, but just for maintaining rapport, I like to let them know that I'm sorry, but these are things that I do have to report. And that's why we talk about it in the beginning during our consenting process. And then one of the other exceptions to confidentiality is if there is a court order to release your medical records. So because I work in the medical system, my notes are part of the medical chart and they often do have to get released if there is a court order. We are not allowed to say no to a judge. Let me know if you have any questions. There are other additional exceptions for when a child can consent independently versus when we have to have caregivers involved. Let me know if you want me to make another video about that.